Hi, welcome to Health Matters. My name is Sherry Gallant. I'm with Alberta Health Services, and today we're talking with Heather Mather. Heather is a population and public health dietitian with Alberta Health Services, and we're going to talk about a subject that vexes many parents, the secrets to preventing mealtime battles, establishing a healthy feeding relationship for infants and young children. This is a good one. What is a healthy feeding relationship, and how can parents and caregivers contribute to the development of a healthy feeding relationship?
Thanks. Yes. That's really where it all starts, is how you're feeding your child and where you start with. So a healthy feeding relationship involves listening to your child, knowing when your child has had enough to eat and is full. So knowing your child's role. So the child's role is whether they're going to eat the food and how much they're going to eat of the food. And that's really important to know that that's your child's role, because parents often want to control that role, but it is the child's role to control. So the parent's role, though, is what food is going to be served, and ideally it should be healthy foods from Canada's Food Guide. Where that food is going to be served is the parent's role, and ideally it should be at your family dinner table with the TV off and just focusing on each other and the food. And how often the meal will be served is also the parent's role. So having regular meals and snacks is an important role for parents to take. Tiny tummies, they need frequent meals and snacks when children are young. So remembering those roles, but really letting go of the roles of the child, which are the child is responsible and should be able to decide what they're going to eat and how much they're going to eat.
Okay. What are some of the signs then that you can watch for that indicate hunger and fullness?
Yeah, so for a little baby, sometimes it's harder. When we have older children, they can tell us that they're full, but for little babies, it's a little bit harder. So some signs to look for: they're crying, they're opening their mouth, they're reaching for the food, they seem interested in what you're eating, are some signs that they're hungry for food. And then signs that they're full, they also could cry. If they're full, they're crying because stop trying to feed me, might be the message. They shut their mouth, so they close their mouth, or they cover their mouth with their hands. They turn their heads away. They seem disinterested with the food, or some signs to look for that they're full. So, but it's really important to know those hunger and fullness signs, and let your child take the cue, because growth can change. Kids might eat more, when they're in a rapid growth phase, they're growing rapidly, or growth can slow down too, so they may not need as much food. So sometimes parents ignore those signs of the child and think, well, this is what you should be eating, but it may not be what the child needs. So it's really important to know those signs of hunger and fullness.
Or misinterpret the signs, like taking it instead of fullness as rejection of the food. Well, no, you're going to eat it.
Yes, exactly.
So we've talked a lot about positive things that parents can do and some tips to help them deal with their children's behaviors, but what are maybe some things that parents should try to avoid doing?
I think people typically, they do want to bribe or coax their children into eating, and those are definitely things that you shouldn't be doing. Even extreme praise for eating a food, avoiding extreme positives or extreme negatives, basically. There's some books too at the library. Ellen Satter's a guru for this topic too. So the public library has books that people can sign out.
What was that author's name again?
Ellen Satter. And her most common book is, it's right here, How to Get Your Kid to Eat, but Not Too Much.
Awesome.
So,
Thank you so much. That's a gold mine of information.
You're welcome.
Thank you very much for watching.